Good morning. Welcome, everyone. My name is Tim Swan, and I've been a home health professional for 13 years. It is my pleasure and my distinct honor to be your MC today for the Save Home Health Rally. Save Home Health is an initiative representing clinicians, patients, and family members from the home health community who are concerned about unprecedented Medicare cuts that are negatively impacting patient access and healthcare jobs across the country. As you all are well aware, Medicare payments for home health care have been deeply cut this year. We are here as a community to voice our concerns and to commend Congressman David McKinley for his support. He has been a great friend to our community and advocate for our issues in Washington, D.C. I think we've got a great panel for you today to discuss some of the issues impacting our community today. I'd like to welcome our first speaker, Lisa Bivens. Lisa is the Executive Director of Panhandle Home Health, a home health agency servicing the Eastern Panhandle of West Virginia since 1976. With experience as a registered nurse in the field, administrator of clinical services, and agency director, and all other duties as assigned, I assume, administrator, Lisa has 3 decades of experience in home care. 3 decades. Please join me in welcoming Lisa Bivens.
Thanks, Tim, for the introduction. It's my honor to be here today to discuss the important issue of home health care. I started home health when I was 12, if that means anything to any of you, for the 30 years that I've been involved in home care. And right now, our nation's healthcare system is under enormous strain. Costs are rising, our population is aging, and chronic disease is widespread. As a result, measures are being taken by our government to try to bring healthcare costs into line. These measures include cuts in reimbursement to home health care providers. This most recent cut comes with many risks, and I believe that most people aren't fully aware of them. Late last year, the Centers for Medicare and Medicaid Services announced plans to impose the maximum cut allowable under the Affordable Care Act for home care. This cut, they call it rebasing, probably doesn't mean anything to you, but the result is the cut to Medicare funding by Medicare is an unprecedented 14% over the next 4 years. Rebasing to this extreme will force as many as 40% of home health agencies out of business, leaving seniors without access to essential care and forcing them to rely on far more expensive healthcare alternatives, such as the emergency room, hospitals, or skilled nursing facilities. Rebasing, or this cut in reimbursement, will also jeopardize workers in our state and cause thousands of job losses in a field that we desperately need more now than ever. This cut is estimated to directly impact more than 7,300 West Virginia seniors and the jobs of more than 2,500 home health care professionals employed by home health agencies across our state. I feel very passionately as a home health clinician that this is the wrong direction if our goal is to reduce healthcare costs in our nation. First, home health care represents the most cost-effective benefit to seniors in Medicare today. Home is the lowest cost setting of health care for anyone. Based on this fact alone, we should be committing more resources to home health care, not less. Finally, home health care offers clinically advanced solutions that deal with some of America's most difficult and costly health problems, especially chronic illnesses or people with multiple illnesses like diabetes, heart disease, or lung disease. Luckily, many lawmakers in Washington, including Congressman McKinley, recognize the severity and the danger of this cut and have introduced legislation to stop it. The Save Medicare Home Health Act repeals the arbitrary across-the-board cuts to home health care for 2015, 2016, and 2017, and replaces them with sustainable reforms that achieve savings by improving care for Medicare beneficiaries and reducing healthcare spending. This solution keeps these seniors where they want to be, at home, receiving high-quality home health care. This is the solution we need to help preserve access to home health for our nation's senior population. As a registered nurse, I've dedicated my life and career to caring for our seniors and others in need. I've seen firsthand the difference that it can make in the lives of our patients and families. So I thank you for supporting home health. Together, we can make that difference meaningful, not only to our own communities, but also to our state and to our nation. It's our responsibility. Thank you.
Thank you, Lisa. Home health as a solution was rampant throughout her presentation, if you couldn't tell. I'd now like to welcome Dr. Olson. She's been a family practitioner in the Parkersburg area for years. She's going to discuss some of the home health care issues from a physician's perspective. Dr. Olson.
Good morning. My name is Dr. Gabriella Olson. I'm a private practice family practitioner here in Parkersburg. I've been practicing medicine for 14 years, 10 years in Parkersburg and 4 years as an active duty family physician for the United States Air Force. Since 2008, I've also served as a medical director for a home health agency that serves Medicare beneficiaries and other home health patients in the Parkersburg area. As you've heard already, home health offers patients clinically advanced care in a cost-effective manner in the setting they overwhelmingly prefer, their home. Throughout the course of my career, I've been fortunate to witness many changes in the delivery of home health and in the manner in which we're able to provide quality, skilled care to patients in the comfort of their living room. Advances in technology and best practices have altered how physicians like myself and clinicians are able to offer home health in the home environment. One thing, however, that has not changed, and I hope will never change, is our commitment to doing what's best for our patients. Taking care of patients is what we do, it's who we are, and it's why we're here today. And so I speak today on behalf of my patient, Mrs. M., who, despite a lack of transportation, was able to complete a course of physical and occupational therapy and get a functional status that was able to keep her in her home after her stroke. And I speak for my patient, Mr. D., who, because of a misunderstanding with his medications and a possible misuse of them, avoided a hospitalization because of the care of his home health nurse. Home health is good for our patients, good for their families and caregivers, and a cost-effective way for us as a society to manage health care. And that is a win-win-win. It gives me a great sense of personal and professional pride knowing that the home health care community is doing today and truly making a difference in the lives of these patients. In today's environment, you often hear how unsatisfied Americans are with our healthcare system. Many consider it to be expensive, unpleasant, and inefficient. As a physician, I too am frustrated when I see obstacles to care and the mounting medical bills that my patients face, which is why I feel so strongly that home health should not only be protected, but policymakers should embrace it. If more seniors received home health when clinically appropriate, we would undoubtedly see better health care outcomes, fewer hospitalizations, and in the end, lower health care spending. Unless steps are taken in Washington to restore Medicare funding for home health, our ability to provide quality, skilled care to our patients will be severely limited. I'd like to thank Congressman McKinley for being here today to hear more about what we're doing in home health in the 1st District and across our state. His leadership and support for home health are exactly what our profession needs to be able to be better healthcare providers for the future so that we can meet the needs of our patients. Thank you, Congressman McKinley, for your hard work in Washington and for being here with us today. I am encouraged by your appreciation for home health and only hope that more of your colleagues in Congress will do more to support home health. Thank you.
Thank you, Dr. Olson. Now I'd like to introduce and welcome to our panel a very special guest today. She is going to share to the Save Home Health Rally her own personal experience, her family member dealing with home health. Tina Rolston's mother was diagnosed in 2011 with breast cancer and began receiving home health care in 2013 to aid in her recovery. Please join me in welcoming Tina.
Hi, everyone. I get to do all the talking about what's personal to me, so we'll hope this goes well. My mother was diagnosed with breast cancer, as he said, in 2011. At that time, she underwent a mastectomy, went through rounds of chemo and rounds of radiation. After the treatment, she began to have issues. There was leaking from the site of the radiated wound, and this didn't heal easily. Since that time, we've had a couple other surgeries. We've been through the hyperbaric chamber. And the strongest people to support my mother has been the nurses that went to her home. The ones who every day packed the wounds that I couldn't do every day. My brothers couldn't do comfortably every day. And my father was as tearful as the rest of us. As much as he tried to assist, he has glaucoma and his own health issues. The nurses cheered them on with every visit. They made sure the medication for my mother's hypertension and her diabetes was monitored, contacted the doctor when there were changes that were needed. She's been admitted to the hospital a few times through the course of all this for antibiotics, changes in wound care, and for 6 months ran around with a hole in her breast, trying to get through a Christmas season because she just wanted to be home with her family. Where would we have been had they not been there to support each and every one of us? They were there if I called because I saw something on the weekend they didn't know about. They were there to the doctor and immediately got through. Mom would have been much more confused had she had to leave. Even to this day, she doesn't want to leave home. She doesn't want to leave Parkersburg. She wants to get her care here and be with her family. I remember one of the days coming home after surgery when Mom talked about, I'm not going to be here any much longer. And I said, now, Mom, that isn't what they're telling us. We're going to be here a lot longer. But she would forget, because over time, Mom's changed. From 2000 till today, she's went from the lady who works every day at the bank to the little old lady that shuffles down the street. I'm glad the doctors are there, but most of all, I'm glad for the nurses who came to help, to give her the encouragement every day to go forward. Put that one step in front of the other one. My mother's healthcare saga is not over, but she is still with me today. And as we progress down the healthcare road, and we're unsure where tomorrow will take us, home health is what I want to always be there. For her to see the smiling faces of the nurses on the days when I'm crying at home. So I thank you very much for working with us. Thank all of you for being here. And I thank you for inviting me to let you know what goes on in the lives of families everywhere.
Tina, thank you for sharing something so personal with everybody today. I know that's not easy. I'd like to now welcome Congressman David McKinley of West Virginia's 1st District to the podium. A lifelong resident of West Virginia, Congressman McKinley has built his career around improving the lives of West Virginians. He was elected to the U.S. House of Representatives from the 1st District of West Virginia in 2010. During his tenure in Congress, he has been a champion for the home health community, fighting for our interests in the powerful Energy and Commerce Committee, introducing first of its kind post-acute care legislation, and now co-sponsoring a bill to roll back the steep Medicare cuts as we've discussed today. It is my distinct honor to welcome Congressman David McKinley.
Good morning to you all. See if we can get the, apparently that's not going to go in there, so I'll hold on to this. Can you hear me all right on this? Thank you, Tim. And Tina, that story, it ought to touch everybody. But I have a feeling that out there are a lot more stories that are like that. Everyone's had that, so thank you for sharing that. And Tim, and Mara, where's Mara back there? Mara has been incredible in working in your behalf for home health care in Washington, walking those halls, making sure in and out of offices, coming to committee meetings. I think it's so very important what she's done. And I want to also talk about some of our staff that Devin Seibert and Audrey have come over here. They've come because I want them out of the Beltway and find out what America's really like, what we're dealing with. And they're getting it. They are outstanding two staffers that we have from Washington to come, because we know that once they start to feel our heart in West Virginia and rural America, it's going to make a difference. And so they've been fabulous. As a matter of fact, Audrey went to her first underground coal mine the other day. So for those of you that have never been, she wanted to experience that. And again, that shows where we're trying to understand how we can relate better, to get out of that beltway so that you can talk to people and understand what it's like, how our people live in West Virginia. So with that, thank you. Thank you for coming here today, for our staff and all of you, because this is a looming crisis, this access to home health care. Just for background note, the biggest divide in Washington is not about Republicans versus Democrats. A lot of people will try to do that. That's there. That's just part of life. We got politics in my church. I've got politics in schools. I know politics is just there. But the one that is probably more sinister and stirring is the divide we have in Washington between rural America, the small towns, and the big cities and the urban centers. And once you grasp it, it took me a while to get that. But once then it starts to explain why we have such difficulty sometimes in Washington to be able to get, because some people in the rural areas where we struggle with things like on our rural post offices, transportation, infrastructure, internet access, healthcare. All these issues are big issues to us in rural America. But in Chicago and Los Angeles, those aren't the issues they're concerned with. So it makes it very interesting with it. But today we're discussing this last one, is the healthcare issue. Now, according to AARP, 89% of seniors want their healthcare at home. And I would agree with that. My mother's an example of that, where she wanted her health care at her home. So why are people now in Washington, why are they concerned about this health care issue? What's going on? Well, it's because under the president's plan, under President Obama, he's cutting the funding for health care. You've heard that in the examples, some that have already been said. He's cutting it for seniors in order to pay for his signature legislation, the Affordable Care Act. The president is cutting home health care by 14% over 4 years. That's the maximum cut, so that we're balancing the health care plan on the backs of seniors. That's not what I think America understood when Obamacare was passed into law. But now we're starting, as people have said, you had to pass it before you knew what was in it. And that's what, unfortunately, I've only been there 4 years. I'd love to have been there part of the debate to find out what they were thinking about. But why would you do this on the backs of seniors? This just it's just incredible and unacceptable. So the point is, we've already had the first round of cuts. Took place in January of this year. And as you've heard earlier from the remarks, that over the next 3 years plus, you're going to see up to 40% of home health agencies go out of business around the country. 40%. They're going to close. And with that, we're going to have that. But I want you to think about that. You know, that's almost half. That's approaching half the agencies around this country will close so that we can fund other programs. But what happens to our seniors? What happens with them? That means over 1.5 million seniors, we're going to have to find their care some other way. 1.5 million seniors. And with that related will be, you've already heard some of the statistics in West Virginia, but extend that around the country. That's 500,000 workers in home health care providers, caregivers, are going to be looking for a job someplace else so that Obama can fund another program and take it away from our senior citizens. That's just wrong priorities with that. So look, where's that at? If you remember my earlier remarks about rural versus urban centers, here it shows up. Alaska is projected to lose 75% of their home health care providers. 75%. Montana, 62. North Dakota, 67. Wyoming, 63% are going to close their doors or lose money and ultimately close their door or start restricting their services so much that people won't get the care that they need. This is purely an assault on seniors in rural America. That's what this thing's coming down to. So here in West Virginia, you've already heard, there are over 7,000, actually there are around 7,300 people who'll be affected with this. This assault on our oldest, sickest, poorest population is unacceptable, and I hope that all of you go out and help us reverse this trend, what's happening with this. So I worked with my colleagues on the Save Medicare Home Health Act, and I was honored to do it. When Mara brought this and said, can we work together, there was no question about it. My experience, family experience with my mother, there's no question I'm going to work on this thing. This bill is intended to repeal the devastating reduction that we're facing now, so that the Alaskas, the Wyomings, the rural Americas all across aren't going to be faced with this issue. But this loss of home health care is not just an issue about good access for our seniors, but it also impacts family members. Think about that. If you don't have home health care, then who's going to take care of our mother or our father or our brother or our sister? It's going to be a family member. They're going to have to leave their workplace to be able to provide this care. So this thing just has a reaching impact for all of us across our society. And the quicker Washington gets to understand this impact, the sooner we'll be able to come up with a solution with that. Secondly, we also need to find efficiencies in our Medicare program so we can maintain that promise that we've made to people. I'm a Medicare recipient. I'm a card carrier. Now that I've reached 68 years old, I have a special interest in how all this thing works out with it all, because we better be concerned about this for all of us. So we've introduced another bill that will develop a model for post-acute care that will improve efficiency, encourage more choice and personal care for patients, and offer significant savings to the overall program. Estimates of this second bill, between $85 and $100 billion a year we could save with this plan. Washington's all over it, sniffing around because they're always looking for money, and here's a way to do it. But what we want to do is make sure that this doesn't affect our home health care, that maybe it's a way to replenish it so that we can take care of our senior citizens without any further reduction. That just, again, it's not acceptable. These two bills are not the silver bullet. They're not. But they go a long way to protecting the services that our seniors in rural areas depend on. We must all and do all that we can to make sure that they're taken care of, but especially in rural America. And that they take care of all those big states, the Montana, the Wyoming, the West Virginia, people even in eastern Kentucky, those areas that are just small areas by population, but they have the same needs as people in the big cities, but they may have to travel miles and miles to get that care. So we got to look at ways that these Obama cuts that are being proposed, and they're underway now. they're not the way to preserve Medicare. We know how, all of us that have involved in healthcare, I served 28 years on a hospital board. You don't make these cuts to help preserve Medicare. You work through efficiency and operation. That's what we do, and we don't ever, should never take it out on our senior citizens to balance the budget on the backs of senior citizens. So let's look for these common sense solutions, look for ways to preserve our home health care, protect our jobs, and make sure we keep that promise to our seniors. Because if there's one thing that we know in life, it's always, is when we give our word, it's gotta mean something. When we say we're gonna do something, I know I stress that with our staff. If we promise that we're gonna give you our all, then we better do it. And that's why I really appreciate our staff, because they help me fulfill my promise. I don't wanna be in Washington as someone that's a politician. At the end of the day, folks, I'm still a civil engineer from Wheeling, West Virginia. I'm trying to do the best I can, and I'm honored to represent you and others throughout the First District of West Virginia to make sure your voice is being heard in the halls of Congress. And I'll fight for you left and right, every which way I can. But it's an honor to be able to stand there for you. So for your efforts, for our home health care, to be advocates, thank you. Help us. Let's all work together. God bless all of you. Thank you very much.
Thanks, sir. He gets you excited, doesn't he? And folks, this initiative does not get traction in West Virginia without this man. Thank you so much, Congressman McKinley. We commend you for your leadership on this important senior care issue and look forward to working with you to protect the delivery of home health care across West Virginia. In closing, I'd like to thank everybody for taking time out of your busy schedules to be here today and encourage you to continue to take part in our advocacy efforts to advance this important piece of legislation for the benefit of home health patients, professionals, and businesses alike. You heard the statistics, you heard the data. Thank you all so much for being here. Be safe.